Tylenol is a very common medication, but what's a little strange and kind of unnerving is that doctors and even pharmaceutical companies don't know exactly how it works. So we're going to take a look at some of the theories on how it works, along with some of the common uses for Tylenol and some side effects and other information regarding this drug. This video is not medical advice. Always consult your physician and follow the recommended instructions on the back of any medication that you're taking. So this does not replace any form of medical education, any form of medical advice. I'm just another guy on the internet showing some random facts about some drugs. So Tylenol is a fairly common medication. We give it to our kids on a regular basis if they have a high fever. It's great at reducing the fever. It's supposedly pretty safe with kids. But what's really interesting is that there's a lot of theories on how this medication works. And we keep understanding more and more about some of the details of it, but it's not exactly something that people have fully figured out. So there's a couple different theories, and it may actually be a mixture of those theories. And we're going to talk about that today, along with some other side effects and typical uses for this drug. So first things first, let's talk about some of the information of this drug. The generic name for this drug is acetaminophen. You'll also see this written down sometimes as APAP, and in other countries, in particular European countries, you'll see this referred to as Paracetamol. The most common brand name for this acetaminophen is Tylenol. So that is typically what you're going to see. And again, there are other acetaminophens that are house brands, Walgreens, that type of stuff. But we commonly refer to this as Tylenol. Now, while this drug is used interchangeably with things like Advil, this is not actually an NSAID or a non-steroid anti-inflammatory drug. This medication is an antipyretic, which means it helps reduce fever. And it's also a non-narcotic analgesic, so it helps reduce pain. So you might take either an Advil or a Tylenol if you are looking to reduce pain, but they're not technically the same class of drug because they work differently in the body. So what is the dose of this Tylenol? Well, Tylenol comes in different forms, but the typical pill that you would take and swallow, that's going to be 325 milligrams. Typically you take 2 of those at a time. And they have extra strength Tylenol, which has become more and more popular. That's 500 milligrams at a time. So 2 of those, which is what's in this packet right here, taken together would be 1,000 milligrams or 1 gram of acetaminophen. So common practice says do not exceed 4,000 milligrams or 4 grams of acetaminophen in a 24-hour time period. Now, this package specifically on the back says don't exceed 3,000 milligrams in a 24-hour period. And 3,000 to 3,200 has kind of become a new standard, and people are kind of gravitating more toward that lower dose or total loading dose in a 24-hour period. Like any other medication, we want to take the smallest amount of medication to get a desired therapeutic effect to relieve our symptoms that we're actually taking this medicine for, without just taking a whole bunch of this medication and piling more on than is actually necessary. So let me just pause on the Tylenol discussion for just a second and say that if you find something helpful in this video, give us a like on the video. That would really help us out. And if you have questions over some of the stuff we're discussing, or if you have heard something different about this medication, leave us a comment below. We'd love to communicate and chat with you on that. If you haven't already done so, hit the subscribe button and make sure your notifications are on so you get an alert anytime we post future educational content. Okay, so this medication is also used frequently in kids. When you use it with pediatrics, you're going to be using this in a liquid form. It's in a liquid form, you measure it out, and then you give it to the kids orally, and this is oftentimes used to help reduce fevers. Now, with that, I'm not going to throw any dosing out because all of that is age and weight based. So just refer to the bottle, make sure that you're following the general directions on that. And the dosing is usually no more than 5 times in 24 hours for a child. This medication is commonly used along with an ibuprofen, both of which are antipyretics. So you can take Tylenol and then 4 hours later take an ibuprofen, 4 hours later take a Tylenol, 4 hours later take an ibuprofen. That spaces each one of those medications out 8 hours from each dose. so that you don't get too much of this medication in your system, but it also allows these two drugs that work differently in the body to both help work on different areas to be able to reduce that fever. So if it is a high fever and you're really worried about trying to get this fever under control, that is one common method, is to use both Tylenol and Motrin to be able to bring that fever down. All right, so when we're talking about class of drug, remember we said this is not a non-steroid anti-inflammatory drug. Because this medication has the pain-relieving properties and the fever-reducing properties that Advil does, we can't think that we can just use them all the time interchangeably, because Tylenol does not have the anti-swelling properties that Advil does. But how exactly does Tylenol work in your body? Well, that's where we come into a little bit of a debate. And to be honest, it seems that most doctors and even pharmaceutical companies don't have a really good, concrete idea of how this is working. Now, there are theories and there are some pretty good hunches at this point, but we don't know for sure exactly how this is working in the body. While Tylenol seems to have very minor side effects when used in a low dose, that should start to raise some question a little bit when we're using a medication that we can't fully tell how it's working in the body. So just of caution, if you have a medication where someone says, hey, I don't really know how this works, it's working well, but we're not real sure, that should just at least raise some red flags. Don't get me wrong, I've used Tylenol, I've given my kids Tylenol, but again, like any medication, we want to limit its use. We don't want to be using it all the time. We want to use it only when we absolutely need to, especially when they say, I'm not really sure how that works. All right, so if you remember from our Advil discussion, we have cyclooxygenase that produce prostaglandins, and prostaglandins are responsible for swelling, inflammation, pain, fever, and all those type of things. So some people say that Tylenol works the same way, but it blocks the cyclooxygenase enzymes in a different way, so it's a little bit different of an effect, and it's not as strong of an effect as the Advil. So that's at least one theory, that it works in the same way, but a little bit differently, so it's a slightly different form of treatment. Another theory is that once it's metabolized in the liver, one of the metabolites from this medication actually works on the cannabinoid system in your body, which is the same system that gives you some form of pain relief when using THC or some form of cannabis. And so that's another idea of how the Tylenol is reacting and working in the body. But one thing that we do know about Tylenol is that it's not very good at peripheral pain blocking. It doesn't really remove the pain or change the threshold of the pain or the feeling of the pain at the site of injury. It's more of a central nervous system blocker. So it blocks the pain more on our spinal cord, where the impulse is coming from the periphery into the central nervous system. And a theory that supports this idea is that Tylenol actually uses serotonin to block the pain impulse coming from the nerves into the central nervous system, and blocks it there in the central nervous system, which kind of makes a lot of sense with some of the other studies and research that's been done. And there's a good chance that all three of these theories may all be playing a part in the relief of symptoms we get when we take Tylenol. But what we do know is that Tylenol has a direct effect on the hypothalamus. Now, the hypothalamus is this small area in our brain that is like the temperature regulation or the thermostat for our body. So when we take Tylenol, it can take that hypothalamus, which has our temperature cranked up during some sort of virus or infection, and it can start to reduce that and say, hey, we need to bump this temperature down in the body. Once the hypothalamus gets this impulse, it will then start to lower the body temperature. So we know that Tylenol has a direct effect on the hypothalamus to be able to control and regulate our body temperature. This is why Tylenol is one of the main medications used for reduction of fever. Now, how does Tylenol get into our body, and how does Tylenol make it out of our body? Well, remember, with some of the other medications we've talked about, you take a medication orally, it goes down into your stomach. The stomach does not really absorb a lot of things into the stomach. It's got a thick lining, it's got a mucosal lining that protects the stomach acid from eating through the stomach. So really, the stomach is just breaking things down So then those objects, or drug in this case, can move into the small intestine where there is a large amount of blood supply around the intestine that starts pulling nutrients and things out of whatever is in the small intestine. And it works the exact same way with this medication. So the Tylenol is broken down in the stomach. It then moves from there into the small intestine. From the small intestine, now it's absorbed into the wall of the small intestine, gets mixed into the blood supply, and the blood supply goes from there directly into the liver. Now, something to note with Tylenol. Tylenol is metabolized in the liver. The liver is responsible for breaking this down and getting rid of the Tylenol eventually. So, because it comes into the body and gets broken down in the liver, we're going to lose a little bit of the potency as it comes through the liver before it makes it out to the rest of the body to have its desired effect. But once the Tylenol makes it through the liver, then it gets circulated through the entire blood system to the entire body, and that's where we start to have effects on the body from that medication. But that blood supply that has Tylenol in it continues to get circulated back to our liver, and our liver is the filter of our blood system. So all blood makes it back through the liver at some point to get filtered as it continues to circulate through our body. Tylenol is no different. It's floating in our bloodstream. It makes it back through the liver. Every time it goes through, the liver processes it more and more, and over time it continues to purge the body of the Tylenol that's in our system. So the liver will purge a lot of these things out of the bloodstream. It will metabolize it and break it down, and then ultimately our renal system, or our kidneys, will continue to filter these things down after the liver's broken it down, and we will excrete that through urine. Because this medication is broken down and metabolized in the liver, this is where we want to be careful taking this if we have any form of liver damage. So if we don't have a healthy liver that can break this down, it may not be safe for us to take a medication like Tylenol that's metabolized in the liver. So that's something you want to watch out for. Also, if we start taking high doses of this medication, and especially if we're taking it over and over and over again, we have to be careful with damaging the liver. Because what happens is about 10% of this medication gets broken down into a toxic metabolite called NAPQI. But this NAPQI only stays in the liver a short amount of time because something else that the liver has called glutathione actually will counteract that and will prevent this NAPQI from remaining in the body and remaining in its toxic form. But we only have a limited amount of that in the liver. So if the liver is damaged, or if you're drinking alcohol at the same time you're taking Tylenol, we are now going to decrease the amount of glutathione that we have, so we can't break that down as much, and we're going to be left with more of this toxic metabolite. So if you're taking more acetaminophen than your body can break down and metabolize, it's going to start to become toxic in your body. If you have liver damage and you're taking Tylenol, it can also become toxic. Or if you are chronically drinking or have a large amount of alcohol while you're taking Tylenol, that can be dangerous for your liver and eventually the rest of your body as well. The plus side of this medication is it's much easier on your stomach than something like an Advil. So if you have chronic ulcers and stomach issues, you might not want to use Advil. If you have some form of liver damage or liver disease, you might want to avoid Tylenol and use Advil as an antipyretic. So thankfully, we do have some options between different medications depending on where we're at. So that's why we want to make sure we consult a physician to make sure we're getting the right medication in the right dose for whatever disease or symptoms we're trying to treat. One more thing I want to wrap up with here is you need to take a look at cough medication if you're taking that. A lot of these cough medications and some other medications also have acetaminophen in them. If you're already taking Tylenol and now you're taking some other medication that has acetaminophen in it, we could quickly overdose and have too much acetaminophen in our body. So make sure we're reading all the labels and we understand what is mixed into some of these cocktails that people are using. A lot of these are over the counter, but they have a lot of these medications and you can have medication toxicity if you're not careful. So to wrap up, Tylenol is a great medication and it works really well to reduce fevers. But like any medication, we want to limit its use because every medication has side effects. And you can overdose on these medications if you're taking too much, too frequently, and your body's not able to metabolize and be able to remove this from your system. We hope this video was helpful. As always, stay vigilant and stay safe.